Hello everyone, welcome to my channel Physiotherapy Online Lectures. Today we are going to study iontophoresis, one of the most important topic in electrotherapy. Iontophoresis. The iontophoresis it divided into ionto. Ionto means ion and the phoresis means the transfer of the ion. Okay. Iontophoresis is referred to the use of continuous direct electrical current to deliver therapeutically, one minute, therapeutically charged active ion across the skin and into the systematic circulation. So, what is iontophoresis? The transfer of ion into by the electrical current through the skin into the systematic circulation is known as the iontophoresis method. Okay, this is the definition of iontophoresis. Now, you go to the principle of iontophoresis. The principle of iontophoresis, it is an electrically charged electrode will repel a similarly charged ion. Okay, electrically charged electrode will repel a similarly charged ion. In other words, we will say that like pole repel each other unlike the poles attract each other. Iontophoresis occurs if the ionized medication is placed under the electrode with the same charge. For example, negatively charged ion placed under the negatively charged electrode, which is known as the cathode, and the positively ions are placed under the positively charged electrode, which is anode. Okay. Now, here we can see from here that this is the cathode, this is the anode. The negatively charged electrodes under the cathode and positively charged electrode on the anode. It is the mechanism. You have to draw this picture in the examination. Okay. Now, the theoretical basis of the iontophoresis is to move an ion through the surface of bodies strength of electric field and resistance of tissues of body to current flow plays a major role. The strength of electrical current density at the electrode body interface determines the velocity of charged ion. This current density may be increased or decreased by changing the size of the electrode. Therefore, larger the size of the electrode, lesser the intensity of current of the particle. This phenomenon is known as the size principle. Okay. A resistance of tissues of body to current flows can be decreased by using the various methods to reduce the skin resistance. Now the skin pathway. What is the skin pathway? The diffusion of ion is highest in hair follicle and sweat gland region. The diffusion of ion, okay, because of its permeable resistance is the lowest. Most important point, the resistance is the lowest in that area, in the hair follicle area. Thus, this process is said to be the pore dependent. Contrast to these other region of the epidermis where permeable resistance is much higher. Okay. This is the delivery of the drug which through the continuously direct current is known as the iontophoresis. Here the skin, this is the skin, it is the active electrode, the indifferent electrode. Okay. Here are the positively charged ion and the negatively charge ion, and this is the blood vessels. Okay. Now, for iontophoresis method, what are the materials used or materials to be required for iontophoresis method? The main materials required for the iontophoresis are constant current stimulator with iontophoresis mode and portable unit. Next, number 2 is two electrode, cathode electrode and anode electrode. Number 3 is medicated iron or drugs. Most important. Next one is saline water, tap water, paper, pads, sponge, small cotton towels, and Velcro straps. Next, the choice of current. Most effective current form used in iontophoresis is continuous direct current. It is the most important. Most effective current used in iontophoresis is the continuous direct current. The direct current is continuous and monophasic in nature. The use of current makes iontophoresis truly non-invasive alternative method to the needle injection of drugs. Alternative method of injection of drugs. Okay. Now what are the parameters? Parameter number 1 is type of the stimulator is constant current stimulator. Current type is continuous direct current. Waveform monophasic continuous waveform. Okay. Now next one is amplitude is up to 5 milliampere. Voltage is 80 volts. Duration of 20 to 40 minutes. Doses 0 to 80 milliampere per minute. Next, the doses. The doses depend upon the chemical strength and the amount of drug delivery into the tissue. Chemical strength. The chemical solution contains relatively low concentration of the drug because an increased concentration of iron does not appear to increase the amount of drug delivery. Okay, the amount of uh, drug delivery into the tissues, the dose is proportional to the current. The dosage formula of the iontophoresis. D means the doses and A is the intensity with milliampere and 2 the total duration of drug delivery is T. So D equal to A into T. Okay. The effectiveness of specific ion will depend upon the following factors. Number 1, the number of ion transferred. Number 2, where the number of ion transferred N is directly proportional to the current density at active electrode and the duration of the low, but inversely proportional to the concentration of the ion. Okay. Number 3 is the depth of the penetration. Number 4 is the combining capacity of ion into the skin. Next one is whether the ion enter the capillaries and are carried away from the site of application of blood. Next one, physiological effects of iontophoresis. Physiological effects of iontophoresis, you can say it is divided into two parts. One is anodal iontophoresis or through the anode electrode. Another one is the cathodal iontophoresis through the cathode electrode. Now, the anodal iontophoresis, the physiological effect number 1 is the positively charged ion placed under the anode electrode. Number 2 attracts negative ion, repels the positive ions. Number 3 water electrolysis, drug dissolving water interface. Number 4 quick sclerolytic acidic reaction under the anode electrode caused by the net hydrogen ion, which is S plus, built up under the electrode. And next one is the hydrochloric acid, water Oxidation is the H plus, skin pH decreases, coagulation of microcirculation, and increased excitability of nerve via hyperpolarization. Just opposite one will be the cathodal iontophoresis, and anodal is the positively charged ion placed under the anode electrode, where in the negatively charged ion in the cathode electrode. It attracts negative ions, it attracts positive ions, it repels positive ion, it repels negative ion. Water electrolysis, here also water electrolysis. A drug dissolving water interface, it also dissolving water interface. Weak sclerolytic acidic reaction, strong sclerolytic acidic reaction. Here, here the hydrochloric acid, here the hydroxide base which is NaOH. Here water oxidization, here it is water reduction. Skin pH decreases, skin pH increases. Coagulation of microcirculation, here reddening of skin and burning sensation. Decreased excitability of nerve via hyperpolarization, increased excitability of nerve via depolarization method. And last two are the electrode buffering system to stabilize the skin's pH shift, and therapeutic effect are according to the type of drug used. What type of drug you are using, that depends upon the therapeutic effect. Now the principle of application of iontophoresis. Before administering iontophoresis, physiotherapist must first select an appropriate technique suitable for the condition. Okay, next consider the skin sensitivity, where the skin is sensitivity to the patient or not. You have to check that. Next one is select the appropriate ion. What ion you are going to deliver, you have to select that appropriate ion. Next one, take the necessary precautions for using certain drugs. If appropriate electrodes are not available, physiotherapist should prepare the electrode of required size, shape and material by himself. Next one, the patient should be positioned in a comfortable and relaxed position. These are the principle of application of electrodes. Now, the preparation of the electrodes is the metal electrodes and self-adhesive electrode. The metal electrodes of aluminum foil electrode and stainless steel electrodes. And next one is the self-adhesive electrodes, which are ready-made single-use rubber electrodes. Okay. The aluminum foil electrodes commonly available in the aluminum foil. You don't have to read the details of these electrodes. Okay. Now come to the next point, which is preparation of medicated ions or lint pad. How we will prepare it? Lint pad can be cotton pad covered with gauze, soft cotton cloth which can be freely absorb water. Okay. The lint pad which are used going to use should be of the cotton pad, which covered with the gauze or soft cotton cloth. Commonly 8 to 6 layers are used for effective drug delivery. Okay, effective drug delivery, 8 to 6 layers are used. The pad should have sufficient capacity to hold the chemical and absorb metabolic products like NaOH, HCl. The water-based medium will help to dilute the chemical and prevent the chance of burn. The lint pad should be free from wrinkle and dirt. To avoid concentration of current, the size of the lint pad should be 1 centimeter bigger than that of the electrode size. Now, take the prescribed chemical according to the percentage or ratio and mix it with the water. For example, 2% solution means 2 ml of chemical with 98 ml of water for 100 ml solution. Some chemical or gel pastes are not easily soluble in water. Use a syringe to flush the chemical into the water repeatedly in order to make it soluble in the water. Still, if it's not soluble, to avoid concentration of the current, the size of the lymph should be 1 centimeter bigger than that of the size of the electrode. Oh, some chemical gel sprays are not easily soluble in the water. Use a series to flush the chemical into the water repeatedly. Once the chemical solution is ready, dip the lymph pad 3 to 4 times into the solution and squeeze into the lymph pad. Then keep to one part of the treated. Place the electrode above the lymph pad, firmly secure. So next, come to the steps involved in treatment of iontophoresis. Set all dials to 0 and select continuous direct current. Reduce skin resistance. Place the electrode on cloth, towel or sponge pad. Maintain the negative electrode size twice the size of the positive electrode. Use rubber bandage or velcro strap to secure the electrode. Next, after increasing intensity of the current, check for the burning or sensation or irritation. After removal of the electrode, look for erythema. If you see the chemical burn, apply talcum powder. Wind up the instrument. Okay. Now, indication and medication used for iontophoresis. What are the indications? Here in the left hand side indication. Suppose number one indication is hyperhidrosis of the hand or feet. What is hyperhidrosis? In case of hyperhidrosis, the medication or ion used is water glucoperonium bromide. Our polarity should be positive or negative polarity, and source is the tap water. Okay. Now, fungal infection. The medication is the copper and polarity is positive and source is copper sulfate. In case of inflammation, we use dexamethasone. Solution is the 4 mg per ml in aqueous solution. The polarity is positive and the source is the dexona. In case of tennis elbow, it is lignocaine, lidocaine, and the solution is the same and the polarity is positive and source is the xylocaine. So, in this you have to read every indication and the medication and its solution, its polarity and source. These details you have to be memorized. Okay. What are the indication of iontophoresis? Hyperhidrosis, the hand of feet, which is the next one is the fungal infection, inflammation, tennis elbow, plantar fasciitis, any type of pain control, lymphedema, and myositis ossificans or calcific deposit, bacterial colonized wound or terminal ulcer. And next is scar tissue formation or keloid tendon adhesion, subdeltoid bursitis, spasm, muscle relaxation, plantar warts, and post-surgical, and Peyronie's disease. Okay, these are the indications. What are the contraindications for iontophoresis? These are the over the damaged skin and open skin lesion, allergy to the therapeutic ion, impaired sensation to the heat and pain stimuli, over electronic implant such as cardiac pressure, pain symptom of unknown origin at present. Dangers and precautions of the potential dangers are the transient skin irritation, electrochemical skin burn, avoid burn that occurs as a result of gaps of air space, wrinkle between the electrode tissue due to inappropriate electrode. Take care of avoid drugs which patient is allergic to. You should avoid the drugs where the patient is allergic to or hypersensitive to the skin. Next one is to minimize the risks of electrochemical burn, keep dose of milliampere per minute within the comfort zone. Comfort level of the patient, use proper electrode. Current density under the cathode and anode is less maximum recommended safe values. Place the electrode in such a way that distance between the electrodes should be at least equal to the diameter of the largest electrode. Poor contact between the electrodes and skin will increase the skin resistance, chances of getting the heat burns. Okay. Next, to reduce the skin irritation under the electrode drop, the skin surface will isopropyl alcohol to remove oil and other impurities. If there is excess hair or clip the hair, no weight or sandbag applied over the electrode increase the pressure leads to the chemical heat burn. Do not use two chemicals or drugs under the same electrode. Avoid administering ions with opposite polarity at the same time. Avoid direct contact of the metal on the skin. Okay. Documentation tips related to our medicine or iron names and its concentration, polarity of iron, concentration of ionic drug solution, types of electrode used, conventional or self-adhesive or buffer electrode, intensity in milliampere, duration of treatment in minutes, and dose is milliampere into minutes. So this is the summary. Meaning of iontophoresis, the term iontophoresis derived from the ionto, meaning ion. Phoresis means transfer. Definition refers to use of the continuous direct electrical current to deliver therapeutically charged and active ions across the skin and into the systemic circulation through epidermis and mucous membrane of the body. Principle of iontophoresis: an electrically charged electrode will repel a similarly charged ion. Okay. The parameters: constant current stimulator is used. Current type is continuous direct current. Current amplitude is 1 to 5 milliampere. Voltage 80 voltage. Dosage is 0 to 80 milliampere per minute. Treatment duration 20 to 40 minutes. Active electrode. This electrode is used to deliver ions into the tissues. Negative electrode should be larger than the positive electrode. Indications are the inflammatory musculoskeletal conditions like tendinitis, bursitis, synovitis, pain, muscle spasm, edema, calcium deposit or myositis ossificans, scar tissues and keloids, hyperhidrosis, fungal infection, bacterial colonized wounds, and dermal ulcer. Contraindications are over the damaged skin and open skin lesion, allergy to the therapeutic ions, sensitivity to metals like zinc, copper, or magnesium, sensitivity to seafood like iodine, impaired sensation to heat and pain stimuli, over electronic implants such as cardiac pacemaker, pain or symptoms of unknown origin at present. Okay, so these are the topic today we have studied is the iontophoresis. Thank you.